Welcome to Concussion, the podcast that dives deep into the world of brain trauma, breakthrough treatments, and inspiring recovery stories. This is episode 29. Let's get into it.
Tonight, we're incredibly lucky to have someone joining us who shares our passion in concussions and what it means for individuals who sustain one or somebody who cares for one in a healthcare space or personally. My name's Abby. I'm a physical therapist, and I'm here with my usual co-host, Travis.
Hey everybody, how you doing? I'm Travis. Got into a motorcycle accident like 9 years ago and hit my head pretty hard. I was I was in a hospital in a coma for 14 days, something to that effect. It was pretty rough. So real quick though, what was the name of your podcast?
Yeah, my podcast is called Brain Wellness, the podcast. It was kind of a goofy name. It was meant to be a whole business, the brain wellness thing, and lots of books from there. I did write a book on migraine help through that. So that's on my website, brainwellnesssolutions.com. So the link to my podcast is on there. The podcast is on all the podcast places. And then I'm on Instagram, Facebook, LinkedIn. Brain Wellness NP will get you to most of my places. Otherwise, Mandi Dickey, Mandi with an I, because my parents decided I should be eternally spelled wrong. And my book that I had written about my first year of recovery is called Welcome Back, TBI Recovery Story from Provider to Patient.
Nice.
Awesome.
That's awesome.
So you have two books.
Yeah, I do. So my first one was Migraine Help from a Unicorn Nurse Practitioner.
Wow.
Nice.
That's very interesting. I look forward to looking into those books as well.
Yeah, sure. So I've been a nurse practitioner for 13 years now. My experience in healthcare spans all the way back to 1999. It's always been in neuroscience to some aspect. And I was a stroke provider until a couple of years ago. I actually was in a car accident myself and sustained a traumatic brain injury, and the world changed. And I learned so much about TBI management, what to do, what needs to be done, where some of the gaps were in healthcare. And when it was finally time to get back to practice, that's where I landed is in concussion, because I became so much more passionate about that than I ever thought possible.
That's
Nice.
a very interesting story that your neuroscience background kind of got more specialized into this. And Travis kind of explained this in his experience with his neurologist as well. Travis and I first met 9 years ago, shortly after he had his accident. And as I said, I'm a physical therapist, and he came to me with a script for his ankles. And with the battery of injuries that he sustained, that was really low on the priority list. But at the time, as a clinician, I was just following what I was told to do, which was treat what's on the script, kind of, stay in the lane of what a doctor deems is appropriate for intervention. And at the time, I was naive enough to stay that path. And Travis and I reconnected 9 years later. And ironically, I went down this path of diving fully into concussions, understanding how this affects athletes, academic professionals, professors, parents. There's just a tremendous ricochet of effect into lives that I didn't fully understand at the time. And ironically, when we reconnected, he was echoing some of the things that he was still experiencing, that I was kicking myself, that I was not aware enough of what I didn't know or able to connect the dots to get him to the care that he needed at the time. So it's ironic that yours, neuroscience, treating strokes, and then went to the specialty of concussion management. Mine was kind of like global physical therapy. And then now I am just full stream all in on the concussion side. So that's pretty neat that you kind of have that wider scope of healthcare experience that eventually became a little bit more specialized.
Yeah.
So from what we've heard, you host a podcast yourself. Tell us about kind of what led to that passion project for you, and anything that you feel comfortable sharing about your experience with a concussion.
Yeah. So I started my podcast back in 2022 because my favorite part of being a nurse practitioner, being a nurse before that even, was always the education part of it. And I've always been big into education in the facilities that I've worked in going out and doing community education. And I just wanted to do more than what I could do within the walls of my contained job. So I started doing the podcast so I could share information about neuroscience in general. So it was anything and everything related to brain health and wellness when it started. And then 6 months later, when I got in the car accident, I actually was switching jobs at that point. I was going to go to a neurosurgery job because I had been wanting to see brain surgery. I'd been wanting to get into that arena for a really long time, kind of felt like I was good to go where I was with strokes. I really wanted to kind of add on to my experience, and I went to this neurosurgery job. I got to see a brain surgery, and then hours later I was in a car accident. And I had 6 months of interviews done, ready to go. All I had to do was just release them every week in planning for training for this new job, because I wanted to be able to focus on this new job, really get into it. And little did I know I was going to need all of those interviews booked already, because I couldn't speak full sentences for the first 6 months. I'd lose my train of thought. I would lose my words. I'd sit there and stumble on words. There's no way that I could run a podcast and do interviews at that time, much less take care of patients. So it was a long road of recovery and trying everything inside the box and then trying everything outside the box, or as I now call it, just the bigger toolbox. So I did the PTOT speech the first 6 months, and we couldn't figure out really what was going on. Actually, no, I wasn't even in speech therapy at that point, because we thought it was just all my headache and that it was going to get better. And we were doing everything that I knew, everything that my doctor knew from learning in medical school and our medical trainings of what to do for concussion, but it just wasn't doing anything. So finally he said to me, I think it's time we need to look outside the box, because we tried everything inside the box and it's not working. So then I started doing things like red light therapy, transcranial laser, added in neurofeedback, worked with a peripheral nerve stimulator, ultimately brought in a neurological chiropractor to do more functional neurology as well. So I was able to get in all of those different things. And over time, I would get a little bit better. I'd get a little bit better, but then I'd hit a plateau. But since working with that neurological chiropractor, I haven't hit a plateau again yet. And that's what actually got me to the point where I could get back to work, because I could remember things enough to actually start remembering my medical knowledge again. It was in that process that I realized that what I needed to do was different than your traditional neurology clinic for concussion. And we do offer all of those things, not within our walls, but referrals. So we look for that bigger picture and what else can we do for patients.
One thing you mentioned, the functional chiropractor, I have been blown away by how integrated their knowledge is between what you can detect even just with eye movements and functional outcomes. They are just, it's changed my practice dramatically by befriending a functional chiropractor and understanding the things that they know I need to learn more about if I want to be good at my job. So that's wild. And now you're out in Minnesota?
Yes.
Did you have to travel pretty far to find those resources?
Surprisingly, no. So as I was building my network, I got on LinkedIn and I started looking for other people who were in the concussion realm, just to kind of see who could I learn from, what's out there. And my neurologist actually is the one that got me in with the neurological chiropractor. He's like, I think you need to go see this guy, because he'd gotten introduced to him. And I'm very blessed to have a neurologist that was my provider, who was also my friend prior to all of this, who is now my boss in all of this, just being open-minded and seeing what can we do and what other things are out there. And anytime we find something new, we do the research and try to figure out, is it something that we wanted to implement? Is this something that looks like it's actually going to be beneficial? Because that's one thing that people don't often realize, is that there is a lot of research on these non-traditional treatments. It's just not in the mainstream.
Yeah. Well, we're incredibly lucky to have your expertise here. And then Travis, if you don't mind kind of giving us some background as to why we have the topic that we do today, how it's been something that really shaped your path forward after your TBI, how it affected you in so many ways, and then where we are now with kind of recognizing this was a consequence of the head impact.
Yeah, so I guess one of the biggest things that I didn't really notice, but I did kind of notice now that I look back at it, was the emotional deregulation that I kind of lost control of a lot of emotions. And I remember, like, specifically, there would be specific like commercials or movies. So it was 2016 when I got into a motorcycle accident, September 24th, 2016, and I was back home around Thanksgiving, and I would be like watching movies or watching commercials with my family, and they would be like, nothing like dramatically sad, but like just a little bit sad, like maybe like nothing overly sad, but I would be like devastated by them, and I would cry, like, and I didn't understand what was happening, like, but anytime that I would get sad, it would be like really, really, really sad. or if I would get like angry at something, it would be like super angry and for no reason. And so that's, looking back, like that is certainly one of the things that affected me the most. And it still affects me to this day. I'll hear something and I may take it like a certain way. Like, I don't want to say like I'm overly sensitive, but I guess I am kind of overly sensitive sometimes, that where I really shouldn't be. So, and I think that there's a lot of people who go through that exact thing, and they get like extremely angry or they get extremely sad after a concussion or traumatic brain injury. And it's not something you really think about when you're going through it. It's just that thing is that sad, or that thing should make you that mad, or you should take that thing that personally. You don't really reconcile that, oh, well, maybe it's my brain injury that's making me think like this. It just doesn't work like that. So I wanted to get that, that specific information out to people to know, so that they can kind of maybe see it and catch it. And because I was totally oblivious to any of that, like I didn't even know that happened, and apparently it does. So that's one of my main reasons to get this out, so that people can be aware of that.
Yeah, and I have the scope of acknowledging that this is common and happens. And Mandi, we're kind of hoping that with your level of experience and neuroscience background, if you could give us some insight as to, number one, why is this a consequence of concussions?
Yeah, so the jury is kind of out on why. There are several different reasons for it. One could be just the location of the injury. Oftentimes, if people have injuries to their frontal lobe, that's where our personality is. So sometimes our personality traits may change a little bit after an injury, especially if it affected the frontal lobe. And with that, I'm going to back up for just a second. And I'm sure you guys have talked about this on previous episodes, but the coup-contra coup theories with injury. So when you have the injury, people always think about where the injury happened. But it's not just where you hit your head. It can also be the opposite side of the head. So, for example, if you hit the front of your head with an injury, that's called the coup injury. That's where you get that first initial impact. But our brains move back and forth inside of our skull. When it's moving the opposite direction, that's when you get the contra coup injury. So you can actually end up with injury on the opposite side. So we don't just see that frontal lobe injury with hits to the front of the head. It can also be from the back of the head, just from the brain shaking around inside of the skull. So that frontal lobe, that's where our personality lies. That's where our judgment is. So sometimes that ability to judge what kind of personal or emotional response you have can be affected because of the damage to that area. Deeper in the brain, we have this, what we call subcortical white matter. And the subcortical matter includes things like the amygdala and the hippocampus. And if you've heard those terms, those are deep in the brain, and that's where our emotions lie. And right next to that is also the limbic system. So there are several structures in the brain as part of the limbic system. And that again is where our emotions are affected. So when we think about how to be happy about something, how to be sad, angry, all of those emotions come from that central area deep in the brain. And if you have an injury that has any kind of rotational force to it, so if you're in a motorcycle and you're flying through the air and your head changes different directions, or you are facing one direction when a car comes and hits you, you have that extra rotational force deep in the brain. It's very close to the brainstem type of area. So we're not seeing true brainstem injuries, but we're seeing injuries to the hippocampus, the amygdala, the limbic system. So our emotions get significantly affected. And a lot of times people don't realize it. It's the people around them that realize it. So it's your family, your close friends, people at work that you might be offending and not realizing that you're offending them because I joked after my accident, non-joking, that my filter got broken in the accident. So for a long time, I would just bluntly say anything that was on my mind. And to me, it wasn't a mean thing. It was just, those were the thoughts that were coming out of my head. So the brain injured person might not always realize that things that they're saying aren't necessarily appropriate, or they might have really strong emotional responses to something, happy, sad, frustration, anger, and not really be able to control that. So that's deep in the brain, those structural changes that occur. And then we also have chemical changes. So our neurotransmitters get disrupted in the brain, and those sensations where we have those emotional contexts So watching like the Hallmark commercials years ago, it wouldn't have affected you, but now it does because that emotional center is more affected because of the changes in the chemicals in your brain. So we've got structural causes, we've got chemical causes, and then we also have frustration from the injury itself. So if you can't do the same thing as you did before, a lot of patients that have limitations, whether it's cognitive, physical, emotional, whatever it may be, if they're having those limitations, that affects their emotional state as well and can make you more emotional.
Now, on the structural, go ahead, Travis.
I think that's one of the hardest things to kind of get through to other people as well. Because, I work with a lot of dudes and they don't like really, they're kind of no, never mind. Just like, that's kind of an excuse. Don't use that as an excuse. You see how it is, like you should be like this way. And I can get that. I kind of get that too. Like I do see people sometimes taking advantage of things, and that's not something, necessarily that is good. But sometimes it's really not taken advantage of. It's like a legitimate, like, you just don't see it.
In the spectrum of the structural component, so with all those subcortical regions that you mentioned, is it more from the shearing forces or from the swelling that causes those structural changes?
Yes, all of the above. So when you look in the research, there's not been a lot of research done specifically on this area. So there's not really good answers onto which specific cause that it is. And it's hard to say because some of those shearing forces and the swelling is going on at the same time. So it's really difficult to tease out which part it is in particular, especially because there's not a lot of good brain imaging that tells us exactly what's going on in the brain. So we can't get an MRI and say, yep, that was where the area of damage was. That's what was caused from it, because it just doesn't show up on the level that most MRIs catch.
Because the brain is complex.
Yes. Yeah.
From your experience, are shearing forces more categorically affecting gray matter or white matter, or just because I know that there might be different ways in which they can be affected through acceleration?
I think truly it affects both. I don't think we know that to the great extent, again, just because there's not a lot of microscopic imaging that we can get at the time, but based on patient symptoms, all the different reports of symptoms that we're finding now and realizing that are actually related to it, I think it is both gray and white matter.
Okay. Wow. This is really cool to be able to pick your brain at all these different components from a neuroscience perspective, just because it's neat to have like Travis's lived experience. He's been so willing to share that in a way that pulls people out of the dark. For them to hear someone else say that they find themselves acting out of character in ways that they're embarrassed to talk about or ways that have affected people around them, it really puts a lot of that into corners where it never gets addressed. So that conversation about it and then connecting it to, yes, there's a reason. This is what happened in the brain. This is where that consequence comes from, is so important for us to hear, so that way we have a little bit more clarity and willingness to pull these symptoms in. Now, your day-to-day clinical experience, are you experiencing folks that are a few days out from a concussion, years out? What's your primary population?
Yeah, most of my patients have had their symptoms for months to years. At this point, I'm not really seeing the new concussions just because they get seen by their primary and they recover really quickly. So they don't really see me much. It's once they've had symptoms go on and linger for a while. And maybe they've had other treatment and people just haven't put two and two together, but the patient is still very adamant that I had a head injury and I've read it online and nobody's listening to me. And they come to me and they get listened to because I've been there. And I think that's where that unique piece of me having been in the shoes of the patient, I actually understand those things because it wasn't taught in the textbook. It was a lived experience thing that taught me most of what I know about concussion to be true.
Yeah, it's I would say that it's very hard to be able to put how you feel after that into a book. And like, it's like, there's a big difference between like reading it and actually living through it.
One stat that Dr. Schaller shared with me a while back is that divorce rates at the time were 50% higher for those who had suffered a concussion or TBI. And that stat sat very heavy for us because of the realization of, imagine how high that would actually be if concussions were all reported and diagnosed. Because unfortunately, even today, I evaluated 2 concussions, one of which had went to the emergency room, sought care, and was told take a few days off and then get back into work, and had this massive downstream effect. But he didn't have a headache, so nobody in his healthcare circle identified this could be from a head impact. But those consequences that unfolded have significant impact on maintaining your job, maintaining your relationships at home. What have you seen from your patients that really tends to be the final straw for them to speak out and realize I need to advocate for myself and go find care somewhere?
Yeah, honestly, it's not even the headaches that brings them in as much. That is the number one symptom that brings people in, is headaches, but it's not the only thing. I think cognition and cognitive deficits are probably number two. That's the next thing that I see. And that's where I see most people coming in, because they still feel like their memory is just not what it was compared to before the accident, before their injury happened. And that's number one, I think, what I deal with outside of headaches. So they're coming in, they don't feel like they were before. And sometimes it is just that too. Just, I don't feel like myself. So oftentimes they're coming in and they just feel like something wasn't right. And yeah, oh yeah, I had this head injury back then, but nobody ever called it that. Or maybe they just didn't even get told that they had a concussion. And so many of them are not told that, myself included. When I went to a level 1 trauma center, nobody said that I had a concussion. They said it was soft tissue injury and follow with your primary. But having my background, I reached out to one of my former colleagues, and I'm like, hey, I think something's not right. And it was because of that, I think, that he and I were so passionate about making sure that we do get in to see these patients, because they are having lasting effects. And I found, just getting back into work again, a lot of my colleagues in practice don't realize that symptoms can last for any length of time. So years ago, we thought it was just within 3 weeks, people were back to normal and they didn't have a problem, or maybe just a couple of days off and go back to normal. So a lot of providers are still under that thinking because they haven't had updated education on it, honestly.
Yeah. Travis, it's been years that you've had to experience a lot of this downstream effect.
Yeah, absolutely. And like I was just thinking when you said that it takes a while for people to or they're operating off this assumption or this information that they had, the most recent up-to-date information, maybe, how can I say? Well, the thing that we had said recently is that it takes anywhere from 10 to 17 years for once something's found out to get into the medical community, like wide range. Like, it takes a long time. It's like the government, right? Like, everything operates super slow. And you would think that if you learn something significant, it would be like spread out into the world as fast as possible across through all hospitals. Like, there's a wire APP that goes out, but that's not how it works. It just takes forever.
It does take a while for all that researched information to change the way practices are ran and decisions are made in the healthcare field. Now, if we know that this can last for years, if we know that this emotional regulation is something that really can just be a heavy weight that someone has to carry, and meanwhile, your parents and siblings will tolerate some of these outbursts or some of these changes in behavior, but eventually it feels like that support system you once had is slowly starting to fade because those bridges have been burned either through behavioral changes or people not understanding that something happened to you. After this has gone on for such a long time, what are you finding most of your patients are coming to you saying that they've been treated for or diagnosed with as they've been enduring this?
Most of them aren't getting diagnoses. They're just not getting answers. So that's probably the biggest thing that people tell me is they've asked for all the questions and they're not getting the answers. Sometimes they get told they just have PTSD or they have anxiety. And when they have these little attacks of symptoms or anything else, they're just told it's PTSD. Well, they might have PTSD, but that actually prolongs your recovery from a TBI as well. So dealing with the PTSD might actually help their symptoms. So it's not just a PTSD a lot that I'm seeing. And then other times that they're just told that they're faking it from a lot of providers and they don't believe that it's really a thing. And then they might come back and say, well, I've just been told that I'm crazy. So am I crazy? Because everybody just keeps telling me I'm crazy. And that's when I get to say, no, you're not crazy. Your brain is injured and we need to figure out how to deal with it.
What would you suggest to someone who might be in this phase where they know there's been something different since a car accident, a sports-related injury, or something of the sort, and you're doing the right things, you're going to your primary care doctor, or even going to a neurologist, which can happen, and kind of being told what you just illustrated, like this is not what you think it is, you're overreacting or something of the sort. How can you best advocate for yourself in a medical system that sometimes can be very siloed to be able to get to the right place?
Yeah, that's a really good question. I know there are some really good providers out there. Dr. Schaller is one of them. He taught me a lot as I was getting started on this as well, just from having him on my podcast. So I learned a ton from him. There are a lot of really good providers out there. You just have to keep asking. So the number one thing I always tell people, and I stress this on my own podcast too, is that if you're not getting the answers that you want, keep asking, because somebody out there will have the answers for you. You just need to keep looking for it, and don't give up on yourself. When people can remember, keeping good documentation of what happened and when is a great idea. I couldn't remember what was going on. One of my friends encouraged me to take notes and keep track of everything that first year. And I'm so glad I did, because I actually did take that and put it into a book about the first year of my recovery. And I didn't even remember what was happening, but I wrote it all down, and that's where it was super helpful. So I had this spreadsheet on my computer where I could keep track of my symptoms, my appointments, who I talked to and when. And not only did that help me start to remember things a little bit, it helped with my communication with my husband. So yeah, there's a lot of divorces that can happen after brain injury because people change, their communication styles change. They don't remember what's going on. So emotions get high on both parts. But when you can document it and have it in writing so that your partner can see those things, that increases that communication again between you and your partner, whether or not they have a brain injury. My husband was in the car with me, so he did have a little brain injury as well, but that went unchecked for a long time because he was so worried about me.
I didn't even think about that, asking who else was in the car.
Yeah.
That's a very interesting perspective.
So how long ago was that?
Yeah, my injury was in April of 2023. And
Okay.
for the first, like I said, for the first 6 months, I couldn't finish sentences. It was several more months before I really started feeling a little bit more like myself. But it wasn't until closer to the year and a half, almost 2 year mark, when I really started feeling more like myself again. I'm still not back to full time. I work part time, so I'm listening to my body and following my limits now. But it feels really good to be doing something other than being a professional patient. And I think the biggest thing, so along the lines of these emotional things, is making sure that you get treatment. So there are treatments that can be helpful. It's not a cure, but it's helpful. So working with a mental health provider that knows TBI and can help you work through some of those difficulties is really important, so that they can highlight maybe when you say something that's not appropriate, or when you have an emotion that's not appropriate, and they can highlight it for you. And it's not your spouse doing that. It's not your family members that are doing that, so that you're not drawing that wedge between those people that you so badly need to support you during that time frame. And it was actually one of my mental health providers that worked on the PTSD part from the accident with me that brought out her little book at one point, and we talked about acceptance, because acceptance is huge. And I see this all the time with my patients now, that when they don't want to accept where they are, it prolongs the recovery process as well. And it just increases those emotions as you go along. So that acceptance piece, as my therapist brought out her little book, pain, whether it's emotional or physical, plus non-acceptance, meaning you're not accepting where you are, equals suffering. That same pain plus acceptance, you don't have to like it, you just have to accept where you are, equals pain. So that suffering part was optional. And I'm a big Star Wars geek, so that reminded me of the path to the dark side. So then I had a new goal, was to avoid the dark side. And I actually bring that up with my patients now, because it's a really good reminder of needing to accept where you are so that you know what you need to do next.
Yeah, I love that. I love that dark side reference. I think that, so I'm very metaphorical, and I love to use a lot of movie references. And
Yeah.
Abby, she's very unique when it comes to movies. She hasn't seen quite as many as most people, and her and I always joke about that. But I constantly use like references to stories or fairy tales, different types of, all different scenes of movies. And I find that is one of the easiest ways to convey information to people, you know.
Now, when you do have someone who has not accepted, because that is a big struggle of mine, and I've also found that working in the concussion realm, you have to become much more than your role. So I am not a nutritionist. I'm not a psychologist. I am not all these other different facets that we don't have a catch-all for to let these individuals who are trying to navigate a world after a concussion to be able to find where they can find these resources. So it sounds like you're having to do quite a bit of that as well with introducing the idea of accepting the injury. But especially with athletes, I have a really hard time getting to that acceptance piece because there's such a massive loss of identity when they do sustain a concussion and pulls them out. And I've found that I cannot get that buy-in. I cannot get that person on board with this train that we need to keep moving forward until we've realized that this has happened. Have you found any sort of resource, book, professional recommendation, anything that you found that can help connect those dots if you're not able to do it through through that example that you gave?
I haven't yet. I keep looking for that as well because there's not a lot of really good references out there other than my ability to share my own experience with it, because there was a lot of grief involved when I couldn't get back to being a nurse practitioner. And there was a thought at one point that I didn't know if I was going to be able to, because I was not getting back as quickly as I was. And that loss of self is huge. So anything that takes you out of that ability. I have one of my patients has worked for the county for years doing outdoor work. And that is what he loves doing. He had a tree fall on him during that work. And all he keeps asking me is, when can I get back to that? When can I get back to that? And he is nowhere near the level that he needs to be to get back to work at this point. But that's what he keeps going back to. And that's what my patients do over and over and over again, is they're trying to get back to that same person. Mm-hmm. So when it doesn't work to address it that way, and I'll bring it up in multiple appointments. So we'll talk about it one time and then we'll bring it up the next time. The big thing is repeating yourself. So as they hear it over and over and they hear different scenarios about it and different examples of why it's important, they start to realize that they're not alone in that, and that it's not something that's abnormal. So letting them know that these feelings are completely 100% normal. Sometimes that is a key as well. And just letting them be heard. I've had so many patients that have come in and sat in my office and they're like, I don't know why I'm telling you this, because I've never told anybody these things, but just they feel like they can because they feel heard. Mm-hmm. So allowing them the space to have the emotions is also a step in there, just to make sure that they know that they aren't alone and that it is a normal thing and they can feel those feelings and still get better, knowing that once they address those feelings, it will take away a barrier.
Now, Travis, your perspective on this might be unique, and this is kind of making a couple assumptions here. Your level of acceptance, I think, had to be at several different phases, because at first your injury was very visible. I mean, you had a subdural hematoma, you were in a coma. Like it was an injury that if you looked at from the outside, you understood. So is it fair to say that that first initial acceptance of the injury was a little bit easier than the layers that came afterwards that had those residual effects much further along the line?
That's a good question. And I hear you ladies talking about like the acceptance of being where you are, and I guess I'm a very non-accepting person. I think, I don't know, or like I have that never say quit attitude, you know. I'll always try to be a little bit better. And I mean, I don't know if I still even accepted it. Like I kind of always thought I was fine. Like I was like, oh, you know, I'm good. I'm fine. And I'm fine. And my wife said that like one of the biggest things that I would say to nurses, like when I was just coming out of like just being able to talk again, they would ask like how I was doing, and I would always say I'm living the dream. Like, and you know, people say that, like, and I still say that, like I'm living the dream, because I think there's a certain mentality, whereas if you think that you're pretty good, you know, you think that you're doing well, and you think everything's great, then maybe things are great. You know, it's like so if you act like all glum and down and upset all the time, and you look at everything, you have this confirmation bias, right? And everything that you see is like glum and bad. But if you have this I'm fine positive attitude, then maybe things look it's just seeing things more positive. But then I always then again I hate it when people say just be positive about stuff, because there's sometimes where you're not positive, you know, and you're like you said that your feelings aren't wrong, right? Like, I don't think you're wrong to feel any certain way. Like, maybe an action due to a feeling is, not appropriate, but the way you feel, I don't think I don't think you're wrong for feeling any way that you feel, even if it's like super good, like living the dream. I don't know. I don't think it's wrong.
A lot of what Mandi might not know is that Travis's recovery was essentially all self-facilitated. So in that time between when he was discharged from rehab, sent back home, treated for stiff ankles from being in a bed for so long, everything else was through this determination to figure out what happened and why he's feeling that way. And when you were initially talking about all the subcortical areas, Travis brings up the amygdala all the time because he knows that that was something he could identify, that that's where this comes from, and really put a purposeful effort into understanding how he could change things for himself, become a better advocate in that way. So your recovery path has been very different than most, but your levels of recovery also have all different implications. Like, at first, recovery was talking again and then walking again. And that was it in terms of your medical facilitation of recovery. And then years go by where you're experiencing these things that you wish you had a name for, just feeling off, or just feeling like you couldn't have that same thermometer for emotions. You had to work through all that independently. So I don't think yours was an outside in kind of healing versus an inside out. Does that make sense? Like, you didn't have to, no one had to tell you something that you had to accept.
Yeah, I guess not. But I did learn a lot of things. And to be honest, like, a lot of the things I learned were from like completely different philosophers, and I would read like a lot of philosophy. Like, I really liked Alan Watts, and I think he would be a great person to listen to, and he's passed away now, in the realm of like acceptance. Like, sure, I would say that, yeah, I did. I'm probably not the same person that I used to be, but that's not bad. It's like, it's that's okay too. Like, because you don't know. So one of the greatest little philosophy quotes that I kind of live by, that he said was, the story of the Chinese farmer. The Chinese farmer has a horse, right? And the horse runs away, and all the neighbors come around and they say, "Oh, that's terrible. That's terrible." And, the Chinese farmer says, "Well, maybe." And then the next day, the horse comes back, and it's got 5 wild horses with it. And all the neighbors come around, and they say, "Oh, that's great. That's great." And then the next day, his son is training one of the wild horses and throws him off and breaks his leg. And all the neighbors come around and say, "That's terrible. That's terrible." And the Chinese farmer says, "Well, maybe." And the next day, there's an inscription officer coming around, and he's taking all these kids and he's putting them in this terrible war. But they leave his son because his son has a broken leg. And all the neighbors come around and they say, "Oh, that's great. That's great." And the Chinese farmer says, "Well, maybe." Because you don't know. You don't know what tomorrow is going to hold. And life is too complex to let the outcome of something that, or you don't know what the ultimate outcome will be. So there's no real point in deeming anything horrible or, great, because you don't know what that's going to be. You have to kind of live in the moment and just accept it like that. And that's like literally what has gotten me through.
Yeah. I mean, like, that's a very different kind of acceptance that I think you were put in a position where you had to find that for yourself, because you weren't told this is because you hit your head.
Yeah.
Yeah.
And that's one thing that I wish that I could get my patients to understand, is that part right there. And I have kind of referred to that a little bit. So I've termed myself Mandi 2.0 because I am different. And it took my husband telling me, well, we all change over time. So even if I hadn't been in a car accident, I still wouldn't have been the same person I was 2.5 years ago, because we all change over time. And sometimes that is a key to getting patients to realize where things are in the grand scheme of things too, because everybody changes. So you're not going to be a stagnant person that doesn't change over time. So it's just how you're changing and kind of taking it moment by moment like that. But I love the way you thought of that.
And I kind of want to veer off course just a touch, because we're so lucky to have a nurse practitioner that works in the realm of concussions. And something that Travis and I have circled back to a lot that we just want to know more about, like on the neuroscience background, is what about the fatigue? So initially, fatigue makes a lot of sense, right? Like there's a lot of swelling in the brain. There's an awful lot of work to be able to do ordinary things. But what about for folks that are relatively symptom-free, like the headaches, nausea, dizziness is all calmed down? What's the source of that fatigue that can linger months and months after a concussion?
So there's a lot of different theories on this as well. And one that I really learned a lot about in my own recovery was the health of our mitochondria. So this is a term that those of us that work in healthcare, we learned way back in anatomy physiology when we first started our education, and then we never used it again because we never thought that mitochondria was important. But as it turns out, the mitochondria is the powerhouse of all the cells of our body, and that's what creates the energy in our body. And initially, when a concussion occurs, when a head injury occurs, there's actually damage to the mitochondria. So we have these structures in our body that regulates where calcium and potassium go. And those two things go between our cells and our bloodstream on a regular basis, and they maintain different balances. So you need a certain ratio of potassium to calcium, essentially. And when a brain injury occurs, we think of those shearing forces as the cells and causing damage to brain cells, but those shearing forces also happen on a vascular level. And that opens up those channels, and all of a sudden they get reversed. So we have calcium and potassium where they're not supposed to be. So we have an influx of calcium into the channel that actually paralyzes the mitochondria, so they can't create energy. So you have this brain that needs increased energy to try to heal, and yet you can't create the energy for basic functions, much less the energy that you need to heal. And then that starts this whole cascade of energy depletion. So you're constantly in this energy hungry state. You can't create enough energy to do your normal activities of daily living or for healing. And when that prolongs or goes on long enough, that's one reason why we have this kind of lack of energy and excess fatigue. Aside from that, if you have any problems with your vision, if you have any problems with your balance, your vestibular system, if you have problems with auditory processing, so you're not hearing things correctly or you're oversensitized by things that are too noisy around you, all of that is putting effort on your brain as well. And your brain literally cannot keep up with all that. So you end up with cognitive fatigue because it's trying to focus on all these sounds that are coming. It's trying to focus on this incorrect information that's coming from your eyes, from your vestibular system, and that's constantly taxing the brain. So we end up with this increased fatigue, and you feel like you can never get enough sleep at night, regardless of how poor or how well you sleep. You're just never feeling like you're getting enough because your body is constantly in this depletion mode.
So
Yeah, I feel pretty depleted now. I've been up since like 2 a.m.
Oh, gosh.
So in that depletion mode, what is it therapeutically? What can folks do to kind of help turn that in the other direction? Because it sounds like it just continues to self-perpetuate.
Yeah. Yep. So the only real way that I've seen that makes a really good difference is one that I had access to was actual red light therapy. So red light therapy, green light therapy can get down to the cellular level and try to heal the mitochondria. PEMF can also try to decrease inflammation in the body down to the mitochondrial level. And PEMF is very similar to like the Earth's energy. So when you're laying on a good PEMF mat, pulsed electromagnetic frequency, it is the same energy as the Earth. Here in Minnesota, we can't really get out and do a lot of that because you need to stand and walk in the grass barefoot in order to get that Earth's energy. And in Minnesota here, it's either too hot or too cold or too rainy or too muddy or something.
Yeah. My wife is into gardening a lot, and she's like, I want to get my hands into the dirt and I want to feel that. Yeah, that's awesome.
Yeah, absolutely. So getting your hands or your feet into the dirt, into the earth, and touching the earth as much as possible is a really good thing. So many of us, we wear shoes, we're in concrete floors all day long, so we're just not getting that earth's energy. And if you have access to the PEMF, red light, any of those things, that's definitely beneficial as well. And not just any red light, I will say, because you can get little red light boxes for at home, and those are great for your skin, but it doesn't get all the way to your mitochondrial levels going
So
to
what
a
is that?
facility or having it at home.
Can you tell us a little bit about that, the red light therapy? Because I think I've heard that before.
Yeah. So the medical term for it is photobiomodulation. Photo meaning light. Bio is life. So you're adjusting light through light therapy. So think about how plants use sunlight to create energy. That's photosynthesis. Our bodies do the same thing. We are glorified plants, essentially. We need sunlight to work appropriately. So getting good sunlight, which is also really difficult to get. If you can get sunlight without the UVs, you'd be good there too. But we can't really do that much anymore either. So structured red light therapy, there are a lot of different centers popping up around the United States that can do that red light therapy. And some of them are targeted at weight loss. It's still the same red light bed. So note to self on that one. But it gets down to that cellular level. So it changes your body from the inside out. So rather than all the medications that we give that are band-aids on things, and we can try to give stimulants to try to increase your energy level. We can do different treatments to try to make you more awake. But at the end of the day, it's trying to get the cells to be awake again and create that energy to heal it from the inside out so that you don't go back to needing it again. Because once you've been through the treatment, your body's not going to stop. It's already creating the energy.
So the red light therapy is essentially creating more mitochondrial health, and it's not something that they have to continue for the rest of their life.
Right.
And then an ideal dosing, you said, is better for go to a facility that does it, not an at-home unit.
Yeah. Yeah. The at-home units, like I said, they've been tested for skin, and that's where red light therapy started, was for skin treatments. Those are great for your skin. So they'll help to tighten up your skin, get rid of red spots, all that. But it doesn't get down to that deep enough into the tissue to actually work on the cells.
And then how long of a duration is like if they go to like a clinic that has a red light therapy that's able to penetrate deep enough, are they there for a half hour at a time, 2 hours at a time?
It depends on the quality of the bed that they have. There are several different levels of those beds, and it can be anywhere from a 6-minute session in the bed to a 20-minute session in the bed.
Okay. So that's manageable. So like if somebody were working, they could do that in addition to, and that's an effective way to help that chronic fatigue that sometimes can just self-perpetuate.
Yeah. Yep. And again, depending on the strength of the bed, they can do it from 3 times a week up to 6 to 7 days a week. But if it's a really strong bed, you don't want to do more than a couple days a week because you still can do too much of a good thing.
Okay. That's interesting. I'm glad you brought that up, Travis, because you're right. I've heard a lot about that, but I'd have to look and see where we'd have any resources like that local to us. I mean, I bet in Newark, Delaware, there would be something along those lines.
Yeah.
Travis, is there any other questions that you had before I have something I want to ask Mandi?
What about, if we're talking about red light therapy, and what about TMS, like because I was going to, so I signed up for a clinical trial of TMS.
Yeah.
TMS,
transcranial magnetic stimulation.
Yeah.
So depending on where you go and what service they're using, sometimes they also call it PR TMS, personalized repetitive TMS, transcranial magnetic stimulation. So that uses EEG waves. So you initially go in and get almost like a little mini EEG done. And most people think of EEG, the electroencephalogram, as looking for seizures. This is not looking for seizure activity. It's looking at your brain waves to see, are they doing what they're supposed to be doing? So we have 4 main brain waves. They're alpha, beta, theta, and delta. And each one of them has a different purpose for whether you're awake or whether you're asleep, or keeping you more alert during the day, being able to concentrate. So your beta waves are ones that are affected significantly by concussion. And we can see a significant drop in those beta waves. And it makes it really difficult for you to concentrate because the electricity in your brain is off. So TMS uses that thought, and it looks at where in your brain are you most off, and it uses magnetic stimulation through those EEG leads essentially to then treat that part of the brain and get it firing the way it's supposed to fire. So that's treating the electricity part of your brain, which is also very, very important for trying to regulate everything again. And TMS so far has been FDA approved for things like PTSD, anxiety, migraines, OCD. So those are often things we see with people that have concussion. So yes, it can be used with concussion. It's not FDA cleared yet for concussion, but it has been shown to have really good outcomes. And those, depending on where you go, some of them are 5-day-a-week treatments. There are newer ones now that I think it's a once-a-week treatment. So it's a little bit different. So you don't have to go quite as frequently, but typically 4 to 6 weeks, and you can treat most of those conditions.
Wow, it sounds pretty awesome. Let me ask you one more question about concussions. So how about like depression and just feeling like everything is like, man, I just don't care. Like I just don't care about that anymore. It's not interesting to me. Like nothing is interesting anymore.
Yeah, that's unfortunately very uncommon also. Again, either because of structural changes in the brain, those same areas that cause the emotional dysregulation we talked about earlier, or from the chemical dysregulation. The neurotransmitters in the brain, the serotonin, the dopamine, can be affected by concussion as well, and their production is decreased. So you're not getting that same dopamine response or serotonin response from something that's enjoyable in your life. A lot of times people's interests change. They no longer have the same interest in the things that they used to do, or they just have no motivation for anything in a day. And that can definitely be related to those neurotransmitters being just definitely not where they're supposed to be. So sometimes we'll talk about using medications for a short period of time, even 3 to 6 months of it. Use something like an antidepressant might help almost like a supplement to the serotonin. So when you're not creating enough, it's almost like that supplement state when you're taking those antidepressants during that period of time. Ideally, people won't need it long term if we treat it soon. Try to treat it soon after the concussion happens. But if it's been going on for quite a long time, then it takes a little bit more work to get that balance back out again. The good thing about that red light therapy is that it can actually help to treat some of those conditions as well, with or without a head injury. We can see anxiety and depression treated with red light therapy. So lots of benefits from that too. But again, the chemical changes or structural changes or just the damage to certain parts of the brain, such as that frontal lobe, again, too, just changing your likes and dislikes after a brain injury are very common.
Very interesting.
Yeah. I don't like any of the same things that I liked before my brain injury. Nothing.
Even his appetite's different.
Yeah.
Yeah.
Oh, yeah. That's a whole nother thing too. So your appetite can definitely be affected, again, from chemical changes, but also from nerve damage. So we have 12 sets of cranial nerves that come out of our brain. Cranial nerve and the vagus nerve goes all the way down into your bowels. So if that nerve is damaged from the injury, then you can end up with changes in your appetite, changes in your digestive system completely, how you digest your foods, how you absorb your foods, whether or not you end up with bowel obstructions can all be related to that vagus nerve.
And even what food tastes good and what food does not. That's the part that Travis experienced. It seems so like not related, but certainly related into that.
Yeah, like before I never liked mashed potatoes. Like I did not like mashed potatoes. And I loved shrimp. And now like it's the complete opposite. Like I love mashed potatoes and like shrimp.
Yeah, there's so much research coming out about that gut brain axis, especially after concussion. It's really fascinating.
Yeah.
Something I wanted to ask, just because your perspective is so unique. What I usually ask people is, what's the one thing you wish other people knew about concussions? But yours is going to be twofold. What do you wish was the one thing people knew about concussions from a provider side, and then from somebody who's lived it?
From the providers, I wish that my fellow providers out there would understand just how important concussions can be. So because we've been taught for so long that it doesn't last very long and people should recover pretty quickly, I want my fellow providers to actually listen to their patients and believe them when things are not correcting, because we know now that about 30% of patients continue to have lingering symptoms beyond a year. So it's out there. That's a high percentage of patients that continue to have symptoms where we didn't think that was a thing before. So just being open to that idea that things are continuing on and things can be addressed. And for both the provider and the person, that there's no end date in healing. So regardless of when you get identified as having a concussion, whether it's been years and nobody's ever addressed it, or you just had one now, there's no end to that healing. And sometimes that can be frustrating because you want it to go faster, but it's also a blessing because you can continue to try new things and still get new skills back that you didn't have before. In March, I went out to the national conference in DC and I met a gal who had her injury 17 years ago. And she just recently came out to Minnesota to work with one of our neurological chiropractors. And she got rid of her double vision for the first time. So the exercises, the therapies that he had her do corrected her double vision for the first time in 17 years. So there's no end date to recovery.
Right.
Man,
Wow,
I
that's
need to
phenomenal.
like a neurological chiropractor. That's like that just sounds pretty cool.
Yeah. So
They're
depending on where you are in the United States, sometimes they're called functional neurologists, neurological chiropractors, chiropractic neurologists. They go by different terminology, but they're all very similar, and they get trained very well. I love their education. A lot of them have gone through the Carrick Institute and have gotten a lot of the functional training from there. So it's when you can find someone that's functionally trained, you kind of hit the jackpot.
Man, what a conversation. Huge thanks to Mandi for being with us, both as a provider and someone who's walked the road herself. If you're out there struggling and thinking something's just not right, you're not crazy, you're not weak, you're dealing with an invisible injury, and there is help out there. You just have to keep fighting for it. We'll drop Mandi's links below, and as always, thank you for tuning in. This stuff matters. You matter. See you next time.